Foods that must be consumed by diabetes patients. Overview of diabetes and diet importance. Diabetes is a chronic disease that occurs when the body does not produce insulin or cannot use it effectively. People with diabetes must pay close attention to their diet to control their blood sugar levels and prevent complications. Eating a balanced diet that includes carbohydrates, proteins, fats, vitamins, and minerals is essential for managing diabetes. Carbohydrates are an important source of energy but can cause blood sugar spikes if consumed in excess. Whole grain foods such as brown rice, quinoa, and whole wheat bread are great sources of complex carbohydrates that provide sustained energy without causing spikes in blood sugar levels. Diabetics should also limit their intake of processed foods high in refined sugars and saturated fats. Proteins play a vital role in building muscles and tissues while also helping to balance blood sugar levels. Lean protein sources like fish, chicken breast, tofu, legumes, lentils, and nuts are recommended for diabetics as they help to keep them full longer while maintaining healthy blood glucose levels. It is advisable for individuals with diabetes to consult with a registered dietitian (RD), who can help them develop an individualized meal plan based on their health goals and dietary needs. Whole grains, importance and types. Whole grains are an essential component of a healthy diet, especially for people with diabetes. Unlike refined grains, whole grains retain all parts of the grain kernel, including the bran, germ, and endosperm. As a result, they provide more fiber, nutrients like B vitamins and iron, and slow-digesting carbohydrates that help regulate blood sugar levels. There are several types of whole grains commonly available in grocery stores. Some popular options include oatmeal, brown rice, quinoa, barley, bulgur wheat, and whole wheat bread or pasta. Each type has its own unique flavor profile and texture but shares many health benefits. Consuming whole grains can help manage blood sugar levels by slowing down digestion compared to eating processed foods made from refined flour. This is important for people with diabetes because it helps prevent spikes in blood sugar after meals that can be harmful to their health over time. By incorporating different types of whole grains into their diets regularly as part of a balanced meal plan recommended by their doctor or dietitian can help improve their overall health outcomes in the long term. Fruits and vegetables, benefits and recommended servings. Fruits and vegetables are an essential part of a healthy diet, especially for those with diabetes. These foods provide vital nutrients such as vitamins, minerals, fiber, and antioxidants that help in reducing the risk of developing chronic diseases like heart disease and cancer. Fruits contain natural sugars that can satisfy the sweet tooth cravings without spiking blood sugar levels. Vegetables are low in calories and carbohydrates, which can help maintain healthy weight and blood sugar levels. The recommended daily servings of fruits and vegetables depend on age, sex, physical activity level, body size, and overall health status. For adults aged 19 to 50 years old with moderate physical activity levels should consume at least 2 cups of fruit per day and 3 cups of vegetables per day. However, diabetic patients should consult with their healthcare provider to determine their individual recommendations based on their specific medical condition. Incorporating fruits and vegetables into the daily diet is essential for diabetes patients due to its numerous benefits, including reducing the risk of chronic diseases like heart disease and cancer while providing vital nutrients needed for a healthy lifestyle. Consuming recommended servings according to your health needs will help you achieve optimal health outcomes while managing your diabetes more effectively. Lean protein sources, types, and portion sizes. Lean protein sources are essential for diabetes patients, as they help maintain healthy blood sugar levels and aid in weight management. Examples of lean protein sources include skinless chicken breast, turkey breast, fish such as salmon and tuna, tofu, legumes, and eggs. These protein sources contain a high amount of nutrients that are vital for diabetics while being low in fat and calories. Portion sizes are also important when it comes to consuming lean protein sources. A portion size is typically around 3 to 4 ounces or about the size of a deck of cards. A diabetic patient should aim for 2 to 3 servings of lean proteins per day, divided evenly throughout their meals. It is recommended to avoid frying these proteins as this can add extra saturated fats that can be harmful to blood sugar levels. Instead, opt for grilling or baking these proteins with minimal oil usage. Incorporating lean protein sources into a diabetes diet plan is crucial to ensure optimal health outcomes. Proper portion control and cooking methods must be taken into consideration while consuming these foods regularly. By including adequate amounts of well-cooked lean proteins in their diet plans along with other nutrient-dense foods like whole grains, vegetables, and fruits, diabetes patients could effectively manage their blood sugar levels while ensuring overall good health states through balanced nutrition intake regimes. Good fats, sources, and benefits. Good fats are essential for diabetes patients as they help control blood sugar levels and reduce the risk of heart diseases. The two types of good fats are monounsaturated fats and polyunsaturated fats. Monounsaturated fats can be found in avocados, nuts, seeds, olive oil, and canola oil. These foods help lower bad cholesterol levels while increasing good cholesterol levels, which is beneficial for diabetes patients. Polyunsaturated fats can be divided into two categories: omega-3 fatty acids and omega-6 fatty acids. Omega-3 fatty acids are found in flaxseed, chia seeds, walnuts, salmon, mackerel, sardines, and other oily fish. Consumption of these foods can reduce inflammation, which is particularly important for diabetes patients as it reduces insulin resistance. Omega-6 fatty acids can be found in vegetable oils such as corn oil or soybean oil but should be consumed in moderation. In conclusion, incorporating good fats into the diet is crucial for diabetes patients to manage their health effectively. Consuming a variety of sources like nuts, seeds, and fish will provide the necessary nutrients required by the body without compromising on taste or satiety level. Low glycemic index foods, explanation and examples. Low glycemic index (GI) foods are an important part of a diabetes patient's diet. The GI measures how quickly carbohydrates in food are converted into glucose and enter the bloodstream. Foods with a low GI release glucose slowly, preventing spikes in blood sugar levels. This is particularly important for diabetes patients who need to carefully regulate their blood sugar. Examples of low GI foods include whole grains such as oats, barley, and quinoa, as well as vegetables like broccoli, spinach, and carrots. Fruits that have a lower GI include berries, pears, apples, and oranges. Nuts such as almonds and walnuts also have a low GI value. It's important for diabetes patients to incorporate these types of foods into their diets on a regular basis to help manage their blood sugar levels. In addition to choosing low GI foods, it's also important for diabetes patients to pay attention to portion sizes and eat meals at consistent times throughout the day. By making these dietary changes along with other lifestyle modifications such as increasing physical activity levels and managing stress levels, individuals with diabetes can better manage their condition and improve their overall health outcomes. Importance of a balanced diet for managing diabetes. Having a balanced diet is crucial for individuals with diabetes. This means consuming foods that are low in sugar and carbohydrates while being rich in fiber, vitamins, and minerals. A well-balanced diet can help manage blood glucose levels and prevent complications associated with diabetes. Moreover, a balanced diet can also promote weight loss or maintenance, which is beneficial for those who are overweight or obese as they are at higher risk of developing type 2 diabetes. Eating a variety of nutrient-dense foods such as leafy greens, whole grains, lean proteins, and healthy fats has been shown to improve insulin sensitivity and reduce inflammation, which plays an important role in managing diabetes. Ultimately, the key to maintaining a balanced diet for diabetes management is moderation and portion control. Working closely with a registered dietitian or healthcare provider can help individuals create personalized meal plans that fit their lifestyle, while ensuring adequate nutrient intake to manage their condition effectively.